This is In Depth. It's as though COVID-19 was apparently on the ropes a month ago, and it's caught its second wind now and is punching back and punching back. After reopening businesses, cases in Vanderburgh County are approaching now 1,000. Politics aside, what's going on? Let's welcome Dr. Payal Davladabadi, Associate Professor of Public Health at the University of Evansville. Dr. Payal, great to see you tonight. July has not been kind. Most of 2020 has not been kind. Are you surprised by the spike of positive cases in Evansville and Vanderburgh County at this point?
Not really, Brad. We've seen an increase in testing capacity, so as a result, we're seeing more cases being reported, but also at the same time, when we've lifted certain measures, we kind of relied on the public to mask and social distance. This is really the only way to prevent the spread of disease and prevent the spread of cases. And we really haven't been seeing that. And, you know, when you look at grocery stores or other places, people aren't masking, people aren't keeping that distance. We've had various holidays like Memorial Day, July 4th, people get together for gatherings, and these are likely places for COVID to spread. So this is somewhat of a given trend. Just today in the state of Indiana, there were 735 new cases. And so hopefully with mask mandates in various parts of the state, we'll see cases decreasing here in a few weeks.
And we'll get to those mask mandates in just a moment. But in the middle of all this, Dr. Payal, schools are reopening. The EVSC will ring the bell on August 5th. That's in 3 weeks. What's your take on that? Are we ready for that?
Schools will have to implement as many precautions as possible to prevent the spread of COVID. I mean, this includes, of course, masks, social distancing, decreased class density. Indiana specifically is currently at a 7.1 infection rate over a 7-day period. If that rate increases to about 10 to 15%, then a different approach may have to be taken. So again, protecting our kids is very important, and every precaution will have to be taken to minimize that COVID risk.
You know, we thought that young people were relatively not vulnerable to COVID-19, but that certainly is not the case now, and the numbers show it. The University of Evansville student athletes, this strikes very close to home to you, Dr. Payal. 13 tested positive for COVID-19. You're the point person for public health at UE. How did you react to this?
Well, I believe institutions across the country have been preparing and planning for the past few months for COVID at their respective institutions. These 13 cases occurred at an off-campus, non-university sponsored social gathering. And these individuals are currently self-isolating. Contact tracing is being done, so they're doing everything possible to minimize that spread. And we've seen instances like this at various universities across the country. And I hope this is really eye-opening for younger people, just in Indiana, Kentucky, and nationally, that younger people can get infected. The infection rate just in the state of Indiana right now is 39% for the 18 to 39 age group. So initially it was thought that it was mostly older people, but we're seeing more and more younger people being infected. So masks and distancing is very, very effective in preventing spread.
Wearing that mask, public health versus constitutional rights. We have the mayor's executive ordinance in Evansville, but some people flat out say they will not wear a mask. People have been protesting. I've seen people in public stroll into stores, no mask. What would you tell those individuals?
I understand that debate. But again, a mask is such a simple tool, a simple preventive measure that can prevent disease from occurring. At the same time, when you're not wearing a mask, you're putting your friends, you're putting your family at risk of disease. And your family, some may be of high risk. They can have severe complications of this. So again, a very simple and effective method. Masks combined with social distancing significantly reduces spread of COVID. It's about public health, it's about safety, and it's about welfare of our community.
And very briefly, Dr. Payal, what do you see by September? Where do you think we're going to be in all this? Because we'll be heading into winter here in just a few months.
Yeah, so I see a few things happening, hopefully with these mask mandates, Most people will abide. We'll see a decrease in cases. But at the same time, with schools reopening, we may see another surge in cases. But also to remember, we're getting into flu season here in a couple of months. So it's this kind of a wait and see game, but we'll be anticipating a number of trends here in the coming months.
All right, Dr. Payal Patel Davladabadi, the Associate Professor of Public Health at UE. Thank you so much, Dr. Payal. Good to see you, and we'll be talking to you soon.
Thank you, Brad.
You're watching Eyewitness News at 9. Brandon will be right back.